So Floating Doctors, they're a nonprofit. I think they're based out of the USA, but we work in Boca del Toro as well. The Floating Doctors role there is healthcare delivery to really underserved, indigenous, rural communities. Because we have about 24 different communities who all really are so rural, and they're so cut off from modern amenities that they have no access to healthcare. So we bring healthcare to them, and we go to a different community every single week, and we take a boat, hence the Floating Doctors, and we provide care. And the really nice thing is, you get to go back to these communities. So it's not just a one-time, I provide care now and I never follow you up. We go back every single 3 months so we can manage that diabetes, we can manage that hypertension, we can manage these chronic medical conditions. To really make an impact, I think for an organization like this, you really need that longitudinal care, which is one of the biggest impact that Floating Doctors provides.
Welcome to our Crafting Wellness podcast. Today, I have the pleasure of introducing you to Dr. Young. Would you give us a little introduction? Just tell us where you're from, where you currently are, and what you do.
So I'm a South Jersey native, originally from a little place called Edgewater Park, probably not too many people know of, but most of my life's been spent mostly around the Philadelphia area. I went to Cooper Medical School, where I finished my training back in, 2017. And then I did my residency in internal medicine over at Thomas Jefferson Hospital. And I did about 6 months, 7 months of really volunteering as a medical doctor in Panama for the nonprofit organization Floating Doctors.
Yes, and for everyone who doesn't know, that organization is amazing. We're going to talk more about that. But I would love to hear your journey in medicine. Did you always know that being a doctor was something you wanted to do?
That's a good question. So, well, for me, originally in college, I went in to be a geologist. And then I kind of found out over a little bit that wasn't for me. And then I actually switched and got my degree in pre-veterinary medicine. But it was during my time in college where I think I always loved science, and I knew I want to do something medical, but it's a bit of a difficult thing to say. I want to be a doctor. I want to do medicine. It's known to be a big burden. So around my junior year, I think is where I switched from veterinary medicine, which itself is a difficult profession as well, into human medicine. And there was some things I think that kind of led me down that path. I had death in the family. I think that really gave me some inspiration to really try to commit to something and really work hard for something in my life. And I think that's kind of started me along that path, and eventually kind of led me to where I am today.
Absolutely. Yeah. I think for me, college had a similar kind of experience where you go in and you start learning all of these things and experiencing all of this different kind of culture and food wise and all these things that happened to me, where I kind of just woke up my entire world. And I was like, wow. And then you can just kind of discover, it's a lot of self-discovery, I feel like, when you're in college, and you can think you want something going in, and then as you find these new studies, be like, oh no, philosophy for me was a big one that I kind of stuck to and loved and really enjoyed, but I didn't have any idea what philosophy really was until I went to college. And it's interesting how we can find our path sometimes by finding what we don't really want to do, thinking we want to, and then realizing, actually, it's kind of there, but it's more specifically this.
Yeah, absolutely. And I think, it's hard to know really what you want to do with the rest of your life at 17, 18. So
yeah,
everyone usually finds their way eventually, which is a good thing.
Absolutely. Can you tell us a little bit about how many years it takes, generally, that journey?
Oh yeah, absolutely. So I guess the journey kind of starts after college. And then most traditional degrees are 4 years of medical school. And then after that is where the hard part starts. That's residency. I didn't realize I worked with a lot of other people in the Netherlands and other countries. A lot of times, right out of medical school, a lot of other countries, you can go right into be a primary care physician. But USA, it's usually pretty required to do a residency program. And residency is, I did one of the shorter residencies for internal medicine that was 3 years. And then I did an extra 1 year as a chief. But I think the thing I always think about medicine is that you have to be very, very prepared to enjoy learning. Because if you don't enjoy learning, if you don't enjoy sitting down with a book studying, it's going to be a pretty tough road. And I was fortunate enough that even though it was a tough road, I did enjoy it. Sometimes a little bit too much of a good thing. One of the big things is being committed to learning for the rest of your life, or else it's kind of what your job's dependent on. So I think the first, I say 2.5, 3 years, you're sitting in front of a book, and then third, fourth year, and then residency is really when you kind of get in front of the patients, and it's really when it becomes more on the job learning, and kind of goes away from the theoretical and really into what is like realistic and what is pertinent for the situation and for the patient that's in front of you.
Absolutely. So for you, after you did your residency, and is that when you started getting involved in these missions?
Yeah, so that was actually, so Floating Doctors was really one of the first global health mission I was able to do. And I didn't think I was going to do it at first, or I hadn't, maybe put a little bit of thought into doing something like that. But really, is a lot due to my wife. She wanted to travel, and I figured what better way than to go somewhere where you can help people who are underserved and try to make impact on a different community outside of the U.S. For me, it's actually kind of jump in right into the deep end. First experience, and I did it for just got home from Panama, and I did it with work with Floating Doctor about 6 months during my time.
I love that. Yeah, we donated some stethoscopes to Floating Doctors, and then I was doing a little story on it, and then they posted about you, and I was like, oh, so interesting. I would really love to hear more about what this is like over there. Can you tell everybody who doesn't know that's listening and watching right now a little bit about Floating Doctors and what they do and what your role was over there in Panama?
Yeah, of course, love to. So Floating Doctors, they're a nonprofit. I think they're based out of the USA, but we work in Boca del Toro, which is on the Atlantic side. It's basically a Caribbean archipelago. And the Floating Doctors role there is healthcare delivery to really underserved, indigenous, rural communities. So, what we do is we have a batch about 24 different communities who all really are so rural, and they're so really cut off from modern amenities that they have no access to healthcare. So we bring the healthcare to them, and we go to a different community every single week, and all of our medical providers, our nurses, our doctors, volunteers, administrators, they'll come with us. We take a boat, hence the Floating Doctors, and we go to these clinics, and we set up camp, and we stay there. Usually we stay there for the week, sometimes a day if they're a bit closer, but a lot of times we stay there for an entire week, and we provide care. And the really nice thing is, it'd probably be nicer in the future if we could do it more often, but we kind of are dealing with the means of what we have right now. But the nice thing is that we actually get to go back to these communities. So it's not just a one-time, I provide care now and I never follow you up. We go back every single 3 months, so we can manage that diabetes, we can manage that hypertension, we can manage these chronic medical conditions, which to really make an impact, I think for an organization like this, you really need that longitudinal care, which is one of the biggest impact that Floating Doctors provides.
Yeah, the work that you all are doing there is really incredible. I was reading a lot about it, and it's such a beautiful kind of story of how you guys help. How big of a workforce would you say it is with the nurses and the doctors and the administrators and the volunteers? How many people are we talking typically?
So when I first started, this was going back about 8 months ago. This was the middle of COVID. So, a lot of the workforce, especially the medical workforce, is reliant on other countries and, volunteering and professionals coming over and helping. And that had been severely impacted by the COVID pandemic. So when I got there, I was one of 3 physicians and probably about a team of 10 to 12 people. So pretty small. And you're talking when we go out to these communities, we're treating during that week, 100, 120, 130 patients. So it was quite stressful. By the time that I had finished my 6 months at Floating Doctors, we had more like 25 workers at a time going out to these clinics. So it really fluctuates. And fortunately, with international travel being less restricted, it's actually increasing. And I think, even in the next couple of weeks to months, we'll be seeing up to 50. And hopefully, one of the things I'm really hoping for is that further down the line, we'll even be able to we'll have enough people to do 2 clinics at once. So to be able to provide even more access to care for those patients who need it the most.
Absolutely. Yeah. I know it's with COVID and everything that happened. I know that those places probably get hit the worst because people aren't able or weren't able to as easily travel to those places of need and get the care there that's so desperately needed there. Could you talk a little bit about, I know you talked about hypertension, and what has COVID really hit over there in Panama to these more indigenous places, or is it more like hypertension and diabetes and these kinds of things that are affecting them?
It is kind of a mishmash of everything. So going off the COVID, COVID did, hit these communities. It's hard to say exactly how hard it hit them, but from a disease standpoint, but when we go back to community, it'd be like, oh, well, one person died, and what they died from, they had a fever and shortness of breath. So you can never really totally clinch the diagnosis, which we can have in modern medicine. But you're talking about, 1 or 2 people out of a community of 120 dying within that certain amount of time, and dying at the same exact time that a flu-like illness with respiratory complaints was going around that community. So, I think the disease itself did take a pretty significant toll, and many of them were not able to get to a place where they could be administered oxygen. So they unfortunately, died from a potentially preventable death. So that was, definitely impactful. And the second impact, which was, I would say almost just as bad, as there was just decreased delivery of foods and goods to these communities. Everything was shut down in Panama, just like in the USA or other countries around the world. And, for us, we can order things on Amazon. For them, the one store that sells non-perishable food items like rice was not getting any shipments. So sometimes within 3 months of going back, you would see, children being more stunted, decreased growth, malnourished, and you definitely even see adults, losing a ton of weight within that time just from lack of adequate nutrition. So, and I think it's multifaceted the way that COVID affected them from a very pretty severe standpoint.
Yeah, and that has to be frustrating. I feel like as a doctor, global health is so important. It's so easy for us to take for granted, like you talked about Amazon, or just the fact that we have clean water.
Oh, absolutely.
Water situation like there.
Yeah, so the water situation there is tough. So there has been multiple and previous and ongoing attempts to solve the water situation, but the only way that for access to adequate drinking water in many of these rural communities is basically from the roof. The roof collecting rainwater and basically drinking rainwater, which is pretty safe. The problem is that this is a tropical climate, but there are still dry seasons, so that water doesn't last all year. And when that water goes away, they have to drink out of streams, which can be commonly polluted, and gives rise to not only GI worms but most bacterial infections in the book. So that is one of the things that's difficult. Floating Doctors has been working on this, and actually they've teamed up with Engineers Without Borders to actually trying to fix this problem. And they're starting off with one of the communities, Quebrada South. So that's something that's currently underway, but it has been something that's very difficult, not only because polluted water and unsanitary water leads to such illness, but the communities know this. They know that the water is bad, and because they know the water is bad, they don't drink it, and so they're in chronic states of dehydration as well, which is something not to go on for too long, but it's something that you see as well, that there's a new disease entity called Mesoamerican nephropathy. And basically fancy term for people being dehydrated so often and so long that it actually starts developing hurting their kidneys, and eventually can even lead to kidney failure. And something that has been seen a lot of times in farm workers, not as much in Panama. It's mostly studied in, I think, Nicaragua and Costa Rica. But, it just goes to belie that this, water issue is definitely an issue on so many different levels and so many facets.
Yeah, and it makes me really sad actually, because you just think about like even just going to a restaurant here in the United States and people bring you water, and half the time it's not even, people just don't even drink it, and then you have people over here who are literally dehydrating and dying from not having access to clean water, and we're just over here wasting it. It's mind-boggling to me because there's an attitude with water here. I feel like people just don't really want to drink it. They want to drink their sodas and their juices and everything. And I'm a big water lover, if you can't tell. I do a lot of like hot yoga and saunas and stuff. And so I drink a lot of water, and it's like my favorite thing to drink. But it's something I think about because I love it, and because I'm just very aware of how important it is in our body. I mean, what is it? 75% of our body is made up of water. Is that right? Something like that.
Yeah, something about, pretty close. Yeah.
Yeah, and I know that it's really important, and I can feel it when I don't have water, and it just it's obviously something that really needs to be addressed, and people need to understand that it's a problem. It's a major problem in a lot of places.
Oh, absolutely. Yeah. I mean, it's hard to even imagine. Well, when you're there, it's easy to imagine, but being back in the States now, back in Philadelphia, it's hard to imagine. It's like, well, not having access to just clean drinking water, and I've seen the rivers that or the streams that they have to drink out of. Sometimes when they run out of potable water, and they run out of rainwater, and it's definitely tough. It's definitely tough.
Yeah, I imagine so. What has it been like how long have you been back now from Panama?
Only 3 days, actually. Yeah. It's cold.
It's
very cold.
Yeah. I'm sure it's kind of a culture shock too, just after being away for 6 months and coming back to.
Oh yeah, absolutely. Yeah, there's things. Well, even now, it's air conditioning, heat. It's definitely a bit of a culture shock in every sense of the word. Nice to be back in some points, but definitely the weather and the lack of outdoor activities can kind of get you a little bit down, for sure.
Yeah, absolutely. Is it something you think you'll go back and do? Are you going to work with floating doctors more, or are you going to work on other missions, or what's happening now for you in the near future?
Oh, so right now I'm actually waiting. I'm currently unemployed. No, I'm just kidding. I'm waiting to start my job at Cooper Hospital in New Jersey and Cooper Medical School. But going back to floating doctors and help teaching and help care for patients is definitely something that I plan to do in the future. Probably hoping to do 2 or 3 weeks out of my year, but kind of have to see how my new job works out first before I can really commit to anything. But excited
I love that. So okay, there's a couple of questions I have still.
Of course.
For your new job that you're starting, can you tell us a little bit about that? And because a doctor, it's such a general term. Can you
for sure.
a little bit about what it is specifically you're doing, and what kind of doctor you are, and if you have a specialty or?
Yeah, absolutely. So I chose internal medicine for medical school, and mostly because general medicine doctors are a lot of times the teachers in the hospital of medicine. So teachers at at a residency level, but a lot too at a medical school level. And I knew that's kind of what I wanted to get into. So my job going forward is hospitalist, which means a doctor who basically is an internal medicine primary care doctor, but only works in the hospital. So patients who have most of your general ailments, pneumonia, COPD, heart attack, most of that stuff you see on house. A lot of them, if they're not getting surgery, they come to internal medicine, they come to the hospitalist, and the hospitalist is kind of the coordinator with all the specialists to get the patient the care that they need to be healthy and get out of the hospital. And then the other part of my job is education. So I teach, will be teaching at the medical school, as well as teaching at the residency level too. So
Wow, it sounds
a little
like
bit of both, but yeah, it's going to be busy. I haven't started yet, so I don't know how busy it's going to be, but very excited to start soon. And it's the same medical school that I, had done all my medical training at, so I know everybody. So very excited.
Yes.
To go.
So you're home now, but it sounds like you're going to be pretty busy coming up.
Yeah, I was busy before too, so it's nice having. I actually was in Bocas for a little bit. It's kind of a touristy town where a lot of this rural area. So I was off for the month, so I think I need something to do.
I'm curious, how did you even get involved with Floating Doctors? Like, how did you come across them, and what was the application process like? If people want to get involved in the Floating Doctors or something like that, can you walk us through a little bit about what that process is like, and just what it was like for you to get involved?
So for me, once me and my wife were really committed to moving abroad, I went on the internet, I looked at some things, but I didn't exactly find any place that really spoke to me. And then fortunately, one of the other co-chief residents with me, Sonia, her friend mentioned that she worked as a medical student in this place called Floating Doctors. So that's kind of, that referral is really what brought me to them. I looked on their website, which is easy to remember, floatingdoctors.com. So they make that very easy for you to look up. And, it kind of spoke to me, and I saw what they were doing, and I saw kind of their general philosophy, and it really spoke to me. And I think I reached out that day or next day. And then the executive director talked to her, Sam Horn. It was, pretty much went from there. And I don't think I applied anywhere else. And luckily enough, they gave me a job for 6 months, and that was it. But easy to apply to, floatingdoctors.com. If you just go there, you'll find all the contact information, and, they're happy to have volunteers and happy to have people who are going to be there for a longer period of time doing a fellowship, which is what I did. And, very, very straightforward and efficient process. So.
Yeah, it sounds like they need all kinds of people, from doctors to nurses to volunteers to med students, administration. I'm sure they could use all the help they can get. So we'll definitely be linking all of that information in the video. So you can find it and find Floating Doctors and get involved and check out their website, because they're doing amazing work over there.
And, to your point, you really don't need to have, even a job in the medical field. One of the guys that I worked with for a long time, he was our pharmacy coordinator, and he did supply chain in the Netherlands. And he really helped more than I think a lot of people who with medical background could. He made the supply chain more efficient. He ensured that we didn't stock out of things. He got everything we needed, included MDF supplies when we needed it, to our base. Even the workflow got more efficient. You put tape down everywhere for our workflow in the pharmacy, and and it really gets to show you that it's a multidisciplinary project, and you don't need to have a medical background. There's administrative and supply chain, all sorts of other people that make something like this possible.
I think that's really encouraging. But it sounds like you're a really busy person, and healthcare takes up a lot of your time. Medicine takes up a lot of your time. But what do you like to do outside of your job? I know it sounds like your wife loved to travel. Let's get to know you a little bit. Do you have any hobbies? Do you have any outlets creatively, or?
Sure. Yeah. So exercise, is one of the big things. Exercise every day. They always say during medical school residency, you got to just pick at least one thing that you love and keep doing that. So fortunately enough for me, I was able to keep doing that every day, or 5 times a week since since I started medical school. Other things, golfing with my friends with the boys on Sunday is a big thing. So always keep up with that. Instrument, I used to play a little bit of instruments, but not as much anymore. And I think, maintaining friendships, maintaining, family. And we have really close family here that I get to see a lot as well. So I think those are the most important things, the things that, keep me going for sure.
Yeah, I always talk about just like making sure you're living in between the moments of just like the thing that you're trying to go for, whether it's like waiting for your new job to start or studying or whatever it might be. But you can get so super focused on something that you forget to kind of like that other things in your life need your attention. So I think it's great to hear that you've got a close family and you enjoy golfing and exercising. It's all like really important to for mental health and physical health, and just that your whole life doesn't just become your job, because I think that can easily happen when when you're so dedicated. Yeah.
Everything in moderation.
So do you have any advice for other people who want to become a doctor, or any kind of thing that you wish you had known? If you could tell your younger self something, any kind of inspirational thing you want to leave us with?
Yeah, of course. One of the things that always helped me is I think, it's a hard road, but it's, satisfying for sure. But, one of the things that always worked for me is like, looking at learning as not as a chore, but, as a privilege. A lot of people, they don't have the amenities, they don't have the time, they're busy providing for their family, and they maybe don't have access to education. And, for them, learning and sitting and doing something like medicine every day isn't possible. So I think the biggest thing is, when you're sitting down with a book or, you're studying up, like, it's really a privilege and an honor to be able to do something like that to help. And when you kind of maybe change that mindset, even in college, studying to go to medical school, or especially, during medical school, I think it helps you get through it and, kind of deal with the sometimes onerous hours that you put in. Yeah. So maybe that's one, but it's hard to say. I think everyone, I can give my advice, but I think everyone has their own reasons and own philosophy and own way to enjoy what they love.
You touched on privilege, and I think it's something it's easy for us to take for granted, like, oh, I have to study, I have a test, or I'm in residency and it's so difficult, I don't have time for anything. And I know that it's hard, but the fact that you can even pursue it and have the ability to, and can take the time to go after your dreams and become a doctor, and go help people, it's a privilege in the job, and it's a privilege to us as well, the people that you're taking care of, because we need people out there who are dedicated and who are as thoughtful and caring and want to bring health to not just one part of the world, but to bring health and wellness globally, because everybody deserves to be healthy, and we should all be able to have access to healthcare. Yeah,
I totally agree.
What would you say, just to bring it back real fast to the floating doctors,
Sure.
Needs that they have, things that you noticed, how can people help? I know obviously we're going to have a donation link to their website if you want to donate. I'm sure that's always needed. But as far as just anything you really noticed that there's a need there, whether it be for the doctors, the nurses, the med students, whether it be for the patients themselves.
Ways to help. I think there's direct and maybe indirect ways. But I'd say the direct ways, volunteering, not only volunteers, help out with the day-to-day, but, when you volunteer, you help out with, that clinic, and the more people there, the better. Doing a fellowship with floating doctors, it's 6 months usually or more. But you really can make a big impact in that amount of time. Whether you're a physician, whether you're a nurse, physician assistant, nurse practitioner, or like I said, outside of the medical profession itself is also always welcome and needed. And then I think, other ways of direct helping obviously is donation. I think one of the, working directly for floating doctors, one of the things that you get to see is really how efficiently they use the money. We know exactly how much money goes to each thing every week. And I mean, it's spent on, keeping the base running, utilities, and most of it's spent directly on providing medicine and providing medical tools to help the medical team continue to treat these patients. And some of it, if we can't provide every single medicine or every single procedure, we pay directly for these patients to get transport to the nearest place that they can go to. And sometimes that is 6 hours away, but your money directly goes to, a patient who is having sometimes maybe having like a life-threatening urgent illness and needs transportation to the nearest hospital. That's people who donate. That's what their money goes to, not just medicine, not just our medical care that we provide, but these patients, transportation is such an issue from these really remote islands that the only way they can get somewhere is through us. And your money that you donate directly helps these patients getting the care that they need, either from us or if we can provide it from somebody else. So I think those would be, obviously the biggest ways to, help out. And we, work with phenomenal other agencies such as MDF, who has provided with instruments. We've also worked with Blessings, which provides us with extremely low cost medicines. And they're also a nonprofit that is a charitable organization as well. So it really takes actually something I didn't realize, a lot of different nonprofit organizations to really make things like this work. So donating to floating doctors is obviously one way to help out.
Yeah, so well said. I think, we take one person can make a difference, but if we can all come together in ways that we can and help out the ways that we can, then we can even make a bigger impact and bring that health and wellness globally and continue to do that work. So I'm really grateful for you for taking the time to go and do that and to help out and help people. And it's really inspiring to see, because I feel like it's just people can get wrapped up in their own lives and not realize how much need there is out there. And for you and your wife to take the time to go there to another country and help people, it's very inspiring. And I think we're all very grateful to you for doing that. And we encourage everybody listening and watching who wants to donate or volunteer, please go check out the Floating Doctors, thefloatingdoctors.com, and check out all the awesome work that they're doing. Well, Dr. Young, thank you so much for taking the time to sit down with us today on our Crafting Wellness podcast. It's been such a pleasure having you. Do you have any social media handles or any websites or anything you want to leave here for people to come follow you or check you out or anything?
I don't have much. I'm actually not very connected to social media. I did have an old when I was a chief, I recorded all my lectures and I made a Nicholas Young, or is it Nick Young or Nicholas Young? I think it's a Nick Young Medical Education YouTube channel, but that's about all I have. If you want to see some internal medicine residency lectures, you can watch. I think there's about 70 on there.
Oh.
But outside of that, I think I just direct you to Floating Doctors or MDF.
That's awesome. Okay, sounds good. Well, thank you so much.